Hello, dear friends. Welcome in Homeopathic Canada Instagram live session. And today we are going to discuss one of the very important remedy, the polycrust remedy, Apis mellifica. So we use this remedy in very different types of diseases, especially when there is a liver involvement, heart involvement, kidney involvement, any type of tumors, skin diseases, and many more. But what will be the exact pathogenesis, what Apis mel is covered, and how we can differentiate the pathogenesis of Apis mel with the other remedy? We will discuss these two. So Apis is the poison of honeybee. We all know that, and this remedy is prepared in more than one way. In one side, this remedy is prepared from the whole bee, and the other side, this is made from the virus, the poison of the honeybee. So this medicine now to be discussed different in important respect from the substance we have accustomed to regard as drug. So the symptom which is produced by this remedy is very similar as if any person having a bee sting, and that bee sting produce symptom of the body, the same thing you can find out that if the poison or the medicine prepared from the poison is given to the prover, and that remedy goes into the stomach, and that stomach poison remedy produce a similar kind of symptoms. So there are lots of doctors who explain, who give information, and who did experiment with Apis mellifica. Dr. Freire and Brunton, he said that because before then everyone having an idea or everyone having a imagination that if the pathogenesis of this Apis mellifica is very similar to the sting of the bee, then the pathology or the symptom create in disease person having a same criteria. The origination of the symptom in the patient and the origination of the symptom in the drug should be similar. But when the bee sting, immediately there is a different kind of symptom produced in the body. But Dr. Brunton or Dr. Freire, he said that if there is a serpent poison, and that serpent poison does not act when introduced into the stomach, if we introduce the serpent poison directly to the stomach, it will not act. Or when applied to the mucous membrane or serous membrane, it will not affect. And that is, it is only effective when injected directly into the blood. Then it acts. And there is no doubt, more certainly rapidly fatal when enter into the blood directly. That's why when the poison, when the virus of that sting of the honeybee enter into the bloodstream, then the reactions start. Then the reactions start. So, if we consider the bee sting, local effect of bee sting, we will find out different characteristics. What these are like if the sting is here, the part rapidly swollen up, first symptom. And if you touch that part, it become warm. It means there is a sign of inflammation. And inflammation, when there is an inflammation, that the first thing is the swollen part, redness, heat, functional changes, and pain. 5 things are always there. So, bee sting produce a local inflamed part. That part is more or less hot, red, with intense pain. And intense pain is very similar, like there is lots of small needles stinging in the whole body. This type of sensation always present in body. And there is a burning, tingling, and itching. So this is the local effects. If we see if bee sting there, this is the local effects of it. And the simplest and the most characteristic form of pathogenesis that is influenced by the apis it is called acute edema. This is called acute edema. And the cellular tissues being more affected than the skin. Cellulitis, you will see the cellulitis. And I already put one post where the differentiation between cellulitis and erysipelas. So here, skin, the cellular tissues are more affected than the skin. Whenever a similar condition occurs idiopathically, whether the cutaneous or the mucous membrane, you will see the same symptoms there, if we can say that, same area affected, same type of symptoms. Apis will be found curative in this system. If the condition is idiopathic, you don't know how this condition created, but the symptoms are very similar to the pathogenesis of apis, you can prescribe apis mellifica. So that acute edema occurring in the skin is very similar or in the form of erysipelas. So erysipelas is the outermost inflammation of the skin. This is not deep as you will find in cellulitis. Cellulitis is more deeper than erysipelas. So acute edema. So if there is a erysipelas and osteomyelitis like condition, The remedy is Apis mellifica, and that remedy is stand between belladonna and russtox. In belladonna, you will see there are lots of redness. Redness is marked, inflammation is marked, pain is marked, functional disturbance and heat. And as I represent my case of bee sting, so you find that there is inflammation here. Inflammation here, redness, pain, and heat. If you touch the part and that heat remain for a few seconds in your hand, this is the confirmation of belladonna. If any person, a person having a fever, for example, a person having a fever, and you touch the patient, and when you leave the hand, the heat remain, affect the particular area of your hand. And if the heat remains for few seconds on your hand, it means this is the belladonna characteristic. This is belladonna. So Apis is not considering the intense cutaneous inflammation as you can find in belladonna. Apis is not considering the vesicle formations of russtox, but Apis is considered the oedematous conditions of the erysipelas. When there is a oedema there is a oedematous condition. That oedema, that the area where the oedema is produced is not intensely red. There is not intense inflammation. The color of the particular part is not brighter red as you find in belladonna. The color is slightly whitish, and burning and stinging is the main characteristic of Apis mellifica. So this is Apis having their own sphere of oedema. Next, if we see that sore throat, if we talk about the sore throat and sore throat having a specific remedies, like if we compare this with the belladonna and Apis mellifica is not very great redness and pain as you can find in belladonna. What is the indication of belladonna in sore throat? Open the mouth. If the redness is bright redness, shiny redness, intense pain, inflammation is there, pain is there, belladonna. In Apis mellifica, there is a pain, but the pain is not like belladonna, stinging pain, and the throat having a oedematous condition. Oedema is there, and this is not bright red as you can find in belladonna. And this is not like the parenchyma of the tonsil inflamed in brachycarp. This is not similar like that. So, but there is a general oedema. General oedema of submucous cutaneous or submucocellular tissues that covering the tonsils, uvula, soft palate, and the posterior portion of the hard palate. And you will see that it is very similar, that like the bee goes inside the mouth and sting there. So this is a not whitish but similar, like almost dull red color. Dull red color. There are lots of cases of angina is cured by Apis. Dr. Todd, he is dead now. Dr. Todd, he write a book in Clinical Lectures. He explained that in sore throat, especially beginning of the oedema glottis, in which Apis is the great remedy. And it has proved curative in more than one instance of this affection, where the cause was drinking boiling water from the kettle. Person doesn't know the water is, how much that the water is cold. He drink it and there is a oedema in the mouth. This oedema and Apis mellifica. When the oedema of the glottis is produced by the hot boiling water, this is also cured by Apis mellifica. So these are commonly very fatal cases. There are two specific diseases in the throat which are affected by Apis mellifica. First is diphtheria and second is scarlatina. Both having a acute oedematous condition, diphtheria and scarlatina, because there is lots of remedy having a different characteristic, but in Apis mellifica these conditions having a slight, if there is a slight oedematous conditions, then Apis will be the remedy. Apis will be the remedy. So there is one case in which the two person is visit to the bee farms, and the bees are very excited, and one bee is stung the person, and in a few seconds he is not able to breathe. There is a delirious condition, a red rash, very much resembling to the scarlatina, and that point is less bright in color and somewhat rough to the feeling. And in this condition doctor prescribe belladonna to for this condition, and after giving belladonna he produced very large amount of urine, and after that he got cured. Dr. Nenkiewel, he noticed that in a patient affected by it especially, there is a patch of skin on the arm remain white, aimed at surrounding redness. Part is slightly white and there is a redness around it, and was informed that the spot has been a short time previously the seat of the inflammation resulting from the sting of bee. As I mentioned in in picture you can see in different posts. So both eruptions are cured by belladonna. Dr. Grunese, he said that the alternation of perspiration and dryness of the skin. One side he has a perspiration and other side he has a dryness of the skin. Perspiration, dryness of skin. Alternation of the perspiration and dryness of the skin is a characteristic symptom here. Very characteristic. Another thing which is very important to mention here, the other form of acute edema. Apis, and there is a oedematous condition. Slight oedematous condition. If you can find this oedematous condition, you can get the more confident to prescribe this remedy. So, acute edemas are inflammation of the tongue, inflammation of the labia, in both of which apis has been curative. Second, there is a burning, stinging, itching. Burning, itching or tingling, as you can see in bee sting. And if we see the skin, there is different types of eruptions where these eruptions are very similar to urticaria. Urticaria like condition, because in urticaria they are not bright red, they are dull red. Sometimes people having a whitish urticaria. Apis also cover two more skin eruptions like lichen planus and erythema nodosum. Erythema nodosum, and is generally indicated in skin affections not going on destruction of the tissues, but accompanied with excessive itching, burning and stinging characters. These three characters, if present in any kind of skin disease, you can think about apis. Urticaria or hives like erysipelas may manifest itself internally. Here also we have acute edema, but without the tendency to suppurate, belonging to the erysipelatous form. Erysipelatous form, and this distressing and sometimes even dangerous symptoms arising from this cause have several times successfully encountered by Apis mellifica. This is given by Dr. F.B. Smith in Hahnemann Monthly in 1875. In acute edema, erysipelatous or urticarious, we have the pathological condition most characteristic to apis, and upon this I am desirous to fixing your attentions. But both proving and therapeutic record credit the medicine with a range far wider than this, as will appear in the following session. So first, if we thinking, and if we consider these two things, erysipelas and urticaria, and both condition having a oedematous condition. So first, the mucous membranes are not influenced in their general extent by apis. Note it down. Mucous membranes are not influenced in their general extent by apis, but at certain spot it manifests great power. It has frequently proved curative in catarrhal and sacrophilus ophthalmia. Catarrhal condition and sacrophilus ophthalmia. And it is where the cornea is much involved that it most striking curative results are seen. When cornea is involved. So Dr. Jusset expressed great confidence in apis as a remedy of stromous ophthalmia affecting the cornea, and find it is important in these cases to use the solution of virus and note the titturation of the whole bee. It means, he said, if you can find the cases of stromous ophthalmia that affecting the cornea, where the poison of the bee sting is more effective than the titturation of the whole bee, and it causes hoarseness and dry cough, and is often useful in subacute and chronic laryngeal irritation. Subacute or chronic, especially in the mild type, and we can compare with it the Rumex and Carbovec. It irritates the stomach and somewhat the bowels, and it is the best remedy for diarrhea reoccurring every morning. The motions greenish yellow and painless, no pain. Diarrhea reoccurring every morning. Every morning it should be greenish yellow and there is no pain. No pain. So Dr. Wolf recommend this apis mellifica in acute gastroenteric catarrh. This is called dysentery condition, and it is decidedly irritant to kidney and neck of the bladder, and you can find that this irritant to kidney and the neck of the bladder is also covered by cantharis. Cantharis also irritate the neck of the bladder. Dr. Mercy, he recommend apis in chronic nephritis, renal failure, bright disease, and inflammation of the neck of the bladder. It is called irritable bladder. Second point, apis act very powerfully on ovario-uterine sphere. Ovario-uterine sphere, and few medicine cause so many ovarian symptoms, but it has more than once provoked miscarriage when given to pregnant women. So think twice or thrice before prescribing apis mellifica to pregnant women, because it produces abortion. And it has proved very curative in amenorrhea, dysmenorrhea, menorrhagia, which results from active congestion of the ovaries. inflamed ovaries, inflammation of the ovaries, tumor in the ovaries. But the congestion always with stinging, burning pain. If these stinging and burning is there, Apis will cure these cases. Third, so now action of the Apis mellifica in dropsical condition. Dropsical condition. So Apis, its actions on the kidney is sufficient to make it most useful, because homeopathic remedy and acute febrile dropsy. Acute febrile dropsy from chill, person going into the cold and got the dropsical condition, in post-carlatinal dropsy, in incipient bright disease, in that some foundation of the future purpural convulsions. In all these forms of dropsy, Apis has been used successfully, and its curative actions of urine, absence of thirst, is as regarded as a characteristic symptoms of Apis mellifica, especially in recent dropsy, recent, very acute or subacute, recent dropsy. Then there is a serious dropsy like ascites, hydrothorax, hydrocephalus. And these may be results of mechanical or from the obstruction of the circulations, as when ascites results from the cirrhosis of the liver. Means liver involvement, kidney involvement. And in such cases, I am not convinced the Apis dispersing the effusion, nor do I see sufficient evidence that it has ever done so. So it means the dropsical condition, especially from the cirrhosis of liver, we need some other remedy too. But when the dropsy is unabsorbed effusion remaining after serious inflammation, then Apis will clear out the case. So in ascites and hydrothorax remain behind after peritonitis or pleurisy, it has over and over again proved curative, and there is some reason to suppose that it has removed by effusion of cerebral meningitis too. Probably non-tubercular. It should be non-tubercular. It cured them. So, dropsical effusions unconnected with the kidney. Sometimes we have dropsical condition rather than kidney. The kidney is not involved. It may be heart, it may be ovarian dropsy. And these both can be cured by Apis mellifica. Apis mellifica. Second, Apis seem to have same action on synovial membrane. This is one type of serous membrane. Serous membrane. A lady who took 2 doses of 15 drops of tincture found next morning her second right finger began to swell, the middle joint especially being red and hot, and several cases of acute synovitis has been reported in which its curative power were evident. She got Apis mellifica, 15 drops. He took it and the reaction was in front of everyone. Apis also having a reputed in intermittent fever. When the commencement of attack in the afternoon, no thirst, and sensation during the chill as if hand were dead. Hand were dead. This is the indications of Apis mellifica in fever. These are characteristic symptoms of Apis. Dr. Brown, he said this remedy is suggested in the dry catarrh of the nose and larynx, whereas the oedematous condition characteristic of the drug is present here. So there are lots of remedies which are suggestion with this Apis. There is a relation with Apis. First is cantharis and terbinafine in urinary organ, Rumex in morning diarrhea, and laryngeal symptoms, which are very closely resemble, and cutaneous eruptions, anacardium, belladonna, croton tig, rustox, urticaria urines, and affection of serous membrane, apocynon, mercor, and bryonia. And as a whole, the action of Apis more nearly resemble with arsenic. And Dr. Wolf said, use the 3rd to 30 potency according to the sensitivity of the patient. And in most acute affections, advise it alternation with aconite to avoid excessive reaction. So he suggests if there is an acute condition, you can alternate Apis mellifica with aconite. So this is the pathogenesis of Apis mellifica, and hope so this pathogenesis give you some clue in acute not some very recent cases, but subacute or chronic condition in which you can easily find out this remedy. But the investigation give you a clue about the oedematous condition of the parts, or in advanced pathology you can find out the oedematous condition. So let us discuss one case. One lady, 63-year-old, having a diabetes, and when the family member go to the investigation, no kidney involvement, no heart involvement, no liver involvement, but the whole body is swelled up. There is edema, pitted edema on the feet, face, hands, whole body. If she lie in this side, the whole area, this part is swelled up. If she lie in this side, having a swelling here. In history, there is an ulcer, big ulcer in the right side of calf muscles, and that ulcer took 6 months to heal with different type of injection, antibiotics, steroids, etc. After that, she got diabetic, and one day she was she was unconscious as bed. The tongue was swollen and she's not able to breathe. This is hypoglycemic condition. This hypoglycemic condition, the family member picked her up and visited to the emergency ward in hospital, and she stayed there for 4 or 5 days. When I see that case, there is a big swelling, hand, face, under the eyes, and the feet are this much big. Urine output was very, very low. But if we see the whole examination, what they did by doctors, we didn't find anything. All kidney functions are normal, heart movement is normal, liver involvement normal. There is nothing is there. This is idiopathic anasarca. That lady is very reactive. If somebody say anything, she react immediately. And the skin was waxy skin. If we cross it like this, like these kind of skin I have seen in body, whole lines. And after pushing, there is a pit. The pit formation is there. So I asked the doctor in emergency, what is your diagnosis? And he said, we didn't find any diagnosis yet. We treat her symptomatically. So after 3-4 days, they discharge the patient, but still there is an edema on the body. After I prescribe Apis mellifica, because of the reaction, she is very reactive, and if she reacts, she doesn't care about the person. The words are different. Immediately react. So Apis show a wonderful effects. The urine output is increased in 4-5 hours. As the urine increase, the whole water accumulation under the skin is gone. And in third day, there is no water accumulation in any part of the body. Second, the change of behavior. The lady who is very reactive is talking very softly, very intelligently. He talks with children, other members of the family. And I didn't, almost it's 3 months gone, I didn't prescribe any second dose. She is walking now, she is eating well, she is drinking well, but there is no problem at all. No medicines, no allopathic medicine now. And I prescribed that remedy on 27th of April. May, June, July, August. Almost 3 months gone. I didn't change any remedy. Still everything is going on, the skin, no edema, she is walking, she is eating, sleeping good, everything is good. Still, but we are still, that patient is under observation. So characteristic symptoms are important. So sometimes we don't have a characteristic symptom in hand, but if you know the pathogenesis of the patient, if you know the pathogenesis of the drug, and you differentiate this pathogenesis of the drug with other drugs, we can easily find out the exact remedy, and we can easily prescribe the remedy to the patient. So this is a small case, and if you have any questions now, you can ask. If any question you have. If we differentiate this with apocynon, apocynon is also used for dropsy, and anasarca, hydrocephalus, hydrothorax, especially ascites of all kind from all causes occur reportedly in cases cured by apocynon. But if the kidney involved, only, if the kidney involved, and after that kidney involvement there is anasarca, hydrothorax, hydrocephalus, ascites, anything, but it should be present, it should be involvement of the kidney there. If the kidney is not involved and there is a anasarca, there is a hydrocephalus, hydrothorax, we can think about different remedies. But in Apis mellifica, if the characteristic you will find out, like burning, stinging, and audiomatous condition of unknown origin, you can still prescribe Apis mellifica with great results. But if you prescribe apocynon in that point, you will not get success, because in pathogenesis of apocynon, kidney should involve. If there is any ascites, anasarcal conditions, hydrothorax, hydrocephalus, kidney should involve there. But in Apis mellifica, if these conditions present with burning, stinging, and all the characteristic symptom of Apis mellifica, you can still prescribe Apis. Doesn't matter there is involvement of the vital organ or not. We can prescribe and get results. So this is all about Apis mellifica. Thank you so much.